Neprinyl AFD, the strongest systemic enzyme blend on the planet and proven with third-party assay testing. As we age, gradual breakdown of the intestinal lining can occur, allowing contaminants to directly enter the bloodstream. These contaminants accumulate over time, causing the blood to become more thick and abrasive, eventually leading to circulatory and autoimmune complications. So what does Neprinyl do? Well, quite a few things. And you can see here, Neprinyl is able to purify and detoxify the blood, completely improving cardiovascular health. Additionally, Neprinyl can be used as a natural anti-inflammatory. Neprinyl digests immune complexes in the blood responsible for inflammation, as well as digesting dead tissue associated with injuries. So Neprinyl is really able to increase or speed up recovery time. And finally, Neprinyl is able to calm all autoimmune responses by ridding the blood of hundreds of immune system stimulating proteins. Neprinyl allows the immune system to provide normal immune function without having to try to clean the blood. And you can see here on the right, an actual Neprinyl user taking Neprinyl with a really gnarly scar above her lip, and 6 months later you can hardly see that scar, and that's actually Neprinyl's ability to break down dead tissue. So what is fibrin? Fibrin is a necessary protein, but one of the most detrimental at the same time. Fibrin is necessary for healing, but it is released in large amounts in response to many different things, like injury, infection, disease, cellular damage. Basically, anytime there's an immune response, when something's going wrong in the body, you actually produce a whole bunch of fibrin. It's like life's little band-aids. The picture to the right is an actual picture of fibrin in the bloodstream. Excess fibrin acts like a cobweb, making our bodies unable to normally process things in the blood like contaminants, cholesterol, and viruses. Excess fibrin is responsible for many different problems. Before the age of 30, we have a large amount of plasmin in the body. Plasmin is our own natural fibrin dissolving enzyme. Even though we release too much fibrin in response to many different things, plasmin is able to keep excess fibrin from building up. After age 30, production of plasmin starts to fall significantly, allowing excess amounts of fibrin to build up in the blood, which can be responsible for many different things. Now, Neprinyl is more than 10 times stronger than plasmin. So excess fibrin is responsible for a permanent inflammatory state. Basically, your body is in this constant state of inflammation and it just kind of hurts all the time. You have increased body pain, high blood pressure. You can have dangerous blood clots, autoimmune disease, LDL or bad cholesterol will go up. It takes very long for you to recover from anything, injury or surgery. And you also have trapped blood toxins. Get rid of this excess fibrin, and now your body can process everything properly. Now, the following graph demonstrates the superiority of Neprinyl in disintegrating fibrin and other unwanted materials in the blood. The fibrinolytic activity test was performed by a third-party independent lab. As you can see, Neprinyl tested at 36,000 fibrinolytic units per gram, with its closest competitor at only 20,000 fibrinolytic units per gram. Down to the right, the popular product Wobenzyme only measured 6,200 fibrinolytic units per gram, showing that Neprinyl is the obvious choice when it comes to blood cleansing. In a different study, dry blood slides were taken of patients before and after Neprinyl use. Now you can see here on the left, untreated blood belongs to patients with or belongs to a patient with severe arthritis and fibromyalgia. The white blotches indicate high fibrin and white blood cells in the blood, increased white blood cells. This shows an immune response taking place. This patient actually uses several doses of NSAIDs, Tylenol, Advil, or Aleve 3 times per day. Now 6 months later, we take a look at their blood again. The same patient, the blood analysis shows normal white blood cells and fibrin. This patient has virtually no symptoms and has completely refrained from NSAID use. Lab blood values were also taken during the study. Displayed here are the results of a 45-year-old male with osteoarthritis. So you can see here, this patient was 45, he had osteoarthritis, he was recently diagnosed. He complains of chronic pain and inflammation of the wrist and elbow joints. So his treatment was 2 Nepronol capsules twice daily. The objective here is low-dose treatment of Nepronol for 6 months, and we actually wanted to try and eliminate inflammatory blood markers and restore normal movement, and actually this is exactly what happened. You can see here on the right the C-reactive protein in this person's blood, which is actually an inflammatory marker. People with high C-reactive protein typically have arthritis or heart disease or some type of inflammatory condition. So you see here, before the use of Nepronol, this person was at 13.7 milligrams per liter of blood of C-reactive protein, and every 2 months that inflammatory marker decreased significantly, and after 6 months was now down into normal range at 2.8. All the other blood values for this person normalized as well. And just to recap, you can use Nepronol for any of the following: circulatory health, if you have high cholesterol, any type of autoimmune condition, arthritis, fibromyalgia. Reproductive health, women with fibroids do wonderfully well taking Nepronol. Fibroids are just tumors made up of excess fibrin, the same garbage that's in our blood. These women, they develop a fibroid, they take Nepronol, they do a whole lot better. As I mentioned before, circulatory health, any type of heart condition, angina, and then inflammation, sports injuries, or surgical recovery. Nepronol will greatly improve any of those types of situations. Fibrosis, pulmonary and cystic fibrosis, or any type of sclerosis, scleroderma, or MS.